Good morning. Saturday morning. Where else would you rather be than Senate Finance? Would you please take the roll? Please, thank you.
Senator Canizaro, Senator Goycochea, Senator Harris, Senator Neal, Senator Wynn, Senator Severs-Gansert, Senator Titus, Chair Dondero Loop.
Here, and please mark Senator Canizaro absent, excused. And the calling number for today, if you're listening online or will be making public comment at the end, 888-475-4499, and the meeting ID is 833-6791-3706, and press pound. And when prompted for the participant ID, please press pound. Please mute your phones, and we will start with Senate Bill 58. And I believe Mr. McCormick is here to join us. Thank you very much.
Good morning, Chair, members of the committee. Excuse me, my name is John McCormick, J-O-H-N, last name McCormick, M-C-C-O-R-M-I-C-K. I'm the Assistant Court Administrator at the Nevada Supreme Court's AOC. And today I'm here to present Senate Bill 58, more specifically Amendment 3690 to Senate Bill 58. This amendment is what we call in the parlance, I suppose, a gut and replace amendment that deletes the original bill in its entirety, and rather changes Section 1 to add a new section to NRS Chapter 1 to allow the Nevada Supreme Court, within the limits of available funding, to determine the salary and benefits of its employees pursuant to court rule and policy. Then the amendment deletes sections 2, 3, 4, 5, and 6 of the original major and adds sections 7 through 12. And what these sections do is add the clarifying language of within the limits of legislative appropriations for those existing sections in Chapter 1 and Chapter 2 that authorize the Supreme Court or Court Administrator to employ certain persons. And that is the amendment to Senate Bill 58 in its entirety, and I'd be happy to answer any questions.
Thank you very much. Mr. Thorley, could you sort of give us the cliff notes of why this was done after Mr. McCormick's explanation? Thank you.
Thank you, Madam Chair. Wayne Thorley for the record, LCB Fiscal Analysis Division. This was a friendly takeover of Senate Bill 58 by the money committees. As the judicial branch budgets were closed by the money committees, the funding of all court salaries for non-judicial branch elected officials were moved into one budget, and then an appropriation was approved to fund those salaries with the understanding that the judicial branch would determine how that funding would be allocated amongst the positions that are employed by the judicial branch. So this bill would accomplish that. Section 1 adds language that already it's very similar language that is in the governor's chapter of NRS to employ individuals in the governor's office. This adds similar language for the judicial branch that allows them to employ individuals as they see fit, and then it aligns with the money committee's decisions. There will be other language in the Appropriations Act that you all will see next week that adds some reporting requirements and other restrictions that were discussed at the money committee. So if you at the closing, so if you remember that and you don't see it in this bill, it'll be coming later in another bill. And then lastly, as originally submitted, Senate Bill 58 eliminated the distribution of court assessments to the judicial branch, and that is still being accomplished, but that'll come through Senate Bill 448, which was submitted by the Governor's Finance Office. That would eliminate the distribution of administrative assessments to all state agencies, both in the executive branch and the judicial branch. So that's why that's no longer in this bill. But the money committees did approve replacing administrative assessments in the court's budgets with general fund appropriations. You'll just see that in another bill. So happy to answer any questions that anyone might have.
Thank you very much. Senator Wynn, did you have a question? Okay. Anyone else have a question on this? Senator Gansert.
Thank you, Madam Chair. So when we were having the hearings around the judicial branch, basically having autonomy over their employees, there was a discussion about how the pay ranges would be similar to those of the executive branch for the different types of positions. So if it was someone who was an assistant versus a secretary versus, say, an attorney in the judicial branch versus an attorney in the executive branch, say, under the Attorney General's office. And so would you please speak to that? Because this, I believe this is a move to make it all employees unclassified or non-classified.
So Wayne Thorley for the record, LCB Fiscal Analysis Division. So currently, all employees in the judicial branch are non-classified, so this would not change that. But it would allow the judicial branch to set the salaries for those positions as it deems appropriate, similar to the authority that the governor has for his staff.
Thank you. And then kind of going back, if you're an attorney in the judicial branch, or maybe in the Attorney General's office, you could get paid significantly different for the same type of work. I mean, I think we talked a lot about making sure there was some parity for similar positions in different branches of government within the state.
Wayne Thorley, LCB Fiscal Analysis Division. It'll be up to the judicial branch to determine how much they pay their attorneys and their other positions within the limits of the money that was appropriated by the legislature.
Thank you. And just again, I thought we had the conversation. Does my memory serve me that the pay rates needed to be similar to that of executive branch members? Because I understand that this actually allows them to do whatever they want, but I thought we had intent when that discussion was held for a couple of times during our hearings. Maybe that's a question for the judicial branch. I believe the intent was we want to have flexibility, but we understand that we need to pay within the similar ranges as far as other branches of government. And I thought that was the intent.
Thank you. Senator John McCormick, for the record. That is the intent, and the way, as Mr. Thorley indicated, this was funded is it's the appropriation, and that is the extent of the money available. So people have to be paid within that, which then lends itself to similar pay across the state. And as we've examined this and figured out sort of how exactly we're going to handle this, that is how it's turned out. It's extraordinarily similar across the state.
Thank you. And then we also had conversations about the threshold, which still stands, and maybe it'll change, that you can only pay up to 95% of what the governor makes. And I know we specifically had conversations about, I think you had 4 or 5 high-level positions, that the original proposal was for about $198,000 a year. And so would they still be bound by that cap that's currently in statute?
Thank you, John McCormick, for the record. That is my understanding, that they would still be subject to that cap.
Thank you.
Thank you very much for those answers. Senator Wynn.
I do have a question. I was hoping that Mr. Thorley or Mr. McCormick might be able to kind of explain how under this amendment we have more legislative oversight and what kind of reporting there will be, so we understand, and when we come back and we're funding this in the next legislative session, we have a better understanding of where that money was distributed.
Thank you for the record, John McCormick. It's my understanding that as we discussed, or the committee discussed during the budget closing, that was certainly part of it. And it's my understanding that reporting language, et cetera, will go in the Appropriations Act more specifically. And my understanding is that it will require the judicial branch to report to wherever it's decided, LCB, IFC, however that works out in that language in the Appropriations Act, exactly sort of what we're doing.
Are you good with that, Senator? Okay, thank you. Additional questions from the committee? All right, I think we understand the gut and replace, or we have a muddy understanding, but thank you very much. All right, with that, I will go to those in support of Senate Bill 58 here in Carson City. Las Vegas, phone lines, when you're ready, BPS, please.
Thank you, Chair. If you'd like to testify in support of Senate Bill 58, please press star 9 to take your place in the queue. Chair, there are no testifiers wishing to testify in support of SB 58 at this time.
Thank you very much. We'll go to opposition here in Carson City, Las Vegas, and on the phone lines, BPS, when you're ready.
Thank you, Chair. To testify in opposition of Senate Bill 58, please press star 9 to take your place in the queue. Chair, there are no testifiers in opposition at this time.
Thank you very much. And neutral here in Carson City, Las Vegas, and on the phone lines, BPS.
And thank you, Chair. To testify in neutral on Senate Bill 58, please press star 9 to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you very much. All right, with that, closing comments, Mr. McCormick at all? Okay, good, thank you. Then with that, we will close the hearing on Senate Bill 58 and we'll open the hearing on Senate Bill 103.
Good morning, members of the committee. My name is Victoria Gonzalez. I am the Executive Director of the Nevada Department of Sentencing Policy. We house the Sentencing Commission. We are tasked with collecting and analyzing data in order to assist the legislature and the public and the stakeholders in making data-driven recommendations for our criminal justice system. The bill before you today, it came out of the Interim Judiciary Committee out of a presentation from the Fines and Fees Justice Center, who we also have on the line with us in case there's questions from them. What the Fines and Fees Justice Center recommended is that there be a study conducted of misdemeanors in our state. So what the bill did is create basically a misdemeanor study within the Nevada Department, or within the Nevada Department of Sentencing Policy and the Sentencing Commission, as we are the appropriate place to study data and put out those reports. What the bill did, our current statute limits the study of our sentences to felonies and gross misdemeanors. So at a high level, what the bill does is it expands our duties so that we're not limited to just studying gross misdemeanors and felonies, and change some of the duties as well so that we don't have to keep coming back here every time there's an idea to study the criminal justice system, but just broadly allows us to study anything related to the criminal justice system and related to sentences in order for this legislature and the public to have data-driven recommendations. The amendment before you changes the approach. After talking to stakeholders and thinking more about what is important to this state and what's important and consistent with our values in our department and the commission, we're looking for sustainability. And studying misdemeanors is no small task. It's going to require collecting data at the state level, the county level, and the city level from 17 counties, and having the appropriate stakeholders in that conversation. So rather than having a study, what the amendment does before you today is creates a subcommittee within the Sentencing Commission. It is not the intent or the vision of the department or our commission to have a myriad of subcommittees, but because misdemeanors are so large, it makes sense for there to be a separate public body within our agency and within the commission that is dedicated to studying misdemeanors and making sure that this state has an ongoing access to information, data, and analysis about misdemeanors in our state, as we are doing with felonies and gross misdemeanors. So this creates a subcommittee to do that, and then adds makes some changes to the Sentencing Commission for some areas where we were lacking, specifically in the rural areas. You'll notice that we add a DA from the rurals and a public defender from the rurals, and also making sure we have that voice from the central repository as they collect criminal history data and would be relevant to this discussion. discussion as well. And the fiscal note is consistent with that need for all that data that I mentioned we're going to have to collect from 17 counties related to misdemeanors. And again, looking for that sustainability so that you will always have a resource for that data and information from our agency and from the commission. And so with that, that concludes my remarks. Thank you.
Thank you very much, and thank you for being here this morning. Senator Wynn?
Thank you. As a former member of the Sentencing Commission, at first when I saw that there were additions to the Sentencing Commission, it was so large. It gave me heart palpitations and maybe a little PTSD. But in looking at sentencing commissions and what the role of the Sentencing Commission should be, I really support the addition of these individuals to this thing, allowing for this subcommittee subcommittee structure to study these things. And then we all know too well that a lot of times we don't have that data, especially when it comes to misdemeanors, which is really most people's only interaction with the criminal system, if they have anything at all, are for those misdemeanor charges. And so the idea that you haven't been able to study misdemeanors as a part of a sentencing commission that looks at sentences and criminal charges and stuff like that is beyond me. So I'm completely supportive of this, and I appreciate all the work that you guys have done on this. So thank you.
Thank you very much. Additional comments, questions? All right, seeing none, we'll go to support for Senate Bill Senate Bill 103. Go ahead, please, when you're ready.
Thank you, Madam Chair, members of the committee. John McCormick for the record. As a member of the Sentencing Commission, I just support this bill, and I think it's important that we take a broader look and start examining those misdemeanors.
Thank you very much. Any additional support here in Carson City? In Las Vegas? I see somebody on the screen. Are you here for Senate Bill 103?
Madam Chair, Lisa Mosley Sales, are you referring to me?
I am. Good morning.
Yes, ma'am. I was prepared to, Lisa Mosley Sales for the record, I was prepared to present or answer any questions related to the bill if the committee had any, but I am definitely in support. Thank you.
Thank you so much for being with us today. And is there anything else you would like to add at this time?
Lisa Mosley Sales again, just that how important it is that we are able to do this study and do this review, and that your support from this committee is greatly appreciated.
Thank you very much. I appreciate you being here. Anybody that gets up and gets here this early in the morning on Saturday gets their time. Thank you very much. All right, with that, seeing no one in Las Vegas in support, we'll go to the phone lines. BPS, when you're ready.
Thank you, Chair. To testify in support of SB 103, press star 9 to take your place in the queue. Chair, there are no callers wishing to testify in support at this time.
Thank you very much. We'll go to opposition here in Carson City, Las Vegas. On the phone lines, BPS, when you're ready.
To testify in opposition of SB 103, press star 9 to take your place in the queue. Chair, there are no callers wishing to testify in opposition at this time.
Thank you very much. And then we'll go to neutral here in Carson City, Las Vegas. On the phone lines, BPS, when you're ready.
To testify neutral to SB 103, press star 9 to take your place in the queue. Chair, there are no callers wishing to testify neutral at this time.
Thank you very much. And with that, Ms. Gonzalez, I just had one quick question for you. If you could saunter back down to the desk. So my question is, we have an amendment in front of us. I think you covered it when you talked moving one member to two members and mentioned the counties and what have you, but is there anything else in this amendment that you did not cover?
Yeah, I could go through it specifically. So originally what we had was a member who is an expert in fines and fees. And by now putting them on the subcommittee, that takes care of that approach. We did originally have a member from the governor's office, but realized that might not be necessary. That came from an idea from another state. And so realized that I think for the relationship we have and how we communicate things, that need wasn't necessary. And then the subcommittee would have the authority to create working groups. So, and then to clarify the membership of the subcommittee, they would, that'd be the minimum. That's the threshold of the stakeholders that should be on the subcommittee. The members of the subcommittee will be appointed by the chair of the Sentencing Commission. So as long as we have those voices there, the chair would have the discretion to appoint anyone else who seemed appropriate for the subcommittee. I believe that's everything in the amendment.
Thank you very much. Thanks for doing that this morning. All right, with that, seeing no more questions or comments, I will close the hearing on Senate Bill 103. And I will open the hearing on Senate Bill 118. Welcome, Senator Donate and guest. Please go ahead when you're ready.
Good morning, Chair, members of the Committee on Senate Finance. For the record, my name is Fabian Donate, and I'm proud to represent Senate District 10. Today we're here to talk about Senate Bill 118, which revises provisions relating to public health. Really quickly, the policy rationale for this bill is it came out of the interim committee as part of the COVID-19 study that we did. And one of the challenges that our state has faced is with many of the public health folks that you see that will present this bill alongside me is public health is very challenging and it's very hard to predict. We had the COVID-19 crisis, which was the greatest crisis of many of our lifetimes. And when you don't have the ability to respond adequately because the funds are not there, that can result in situations where we are falling behind on our response. And so what you have before you today is the first movement towards sustainable funding towards public health. And I'll let Ms. Gutman-Dodson present the conceptual amendment and what the Public Health Improvement Fund would look like.
Good morning, Madam Chair. For the record, my name is Joelle Gutman-Dodson with the Washoe County Health District. And this amendment in front of you today was the original amendment that we tried to get into Senate HHS. It just came out a little differently than intended. So the goal of this amendment is, instead of creating another account in DPBH, would to allocate the funds directly to local health authorities or its designee. So it just deletes section 3, which is the account described, and then deletes section 5, which stipulates what the account does in section 3. And then we just have some explanation of, in section 4, that the Department of Tax shall apportion on a monthly basis, similar to the C-tax. It would apportion the OTP tax to our local health authorities or their designees. And then the counties that aren't represented by a local health authority, the money would be distributed to DPBH because they serve as their public health representatives.
Thank you so much, Fabian Donate. Chair, that concludes our presentation, and we're happy to answer any questions.
Thank you very much. Questions from the committee? Give us just a minute to digest the information. All right, one of the questions that I have is about the fiscal note. And I think taxation may be here and they may want to weigh in as well. But is there can you tell me about the fiscal note? Can you tell me about the reduction in taxes? Is there, just give me some more information on that.
So when I checked this is Joelle Gutman Dodson for the record. When I checked the fiscal notes this morning, DPBH doesn't have a fiscal note on it. And the money that we would use is a direct allocation from the OTP. So the OTP, the other tobacco products. So it's 35% of the OTP revenue. So that money right now goes to the general fund. So nothing would be removed from somewhere else. It's just directly to the general fund.
So would we still lose 10 million to the general fund?
Yes.
Okay. So there's no fiscal note, but we lose $10 million.
35%. So this is Joelle Gutman for the record, sorry. Right now, that's approximately 12 million. So 12 million is about $4 per capita. So that would be $4 per capita to each county and or local health authority.
And Chair, Fabian Doñate for the record, and the rationale for why they're advocating for this is a lot of the funds that the health district receives are federal grants, and oftentimes federal grants are specified towards a particular disease or encounter. And if you have an outcome where, because you can't use funds for other resources, if there's a disease that appears, for instance, within the last few years, we had COVID-19 funds, but we couldn't use that for monkeypox in terms of for disease tracking, et cetera. And so having a set up pool of funds that aren't categorical that we can use to respond adequately for public health is the infrastructure that the health districts need, which was lacking during the pandemic, and that was part of the response that we had. So.
Joelle Gutman for the record, we don't receive any non-categorical funds right now. So this would be the only money that we could prioritize and use in case of an emergency or priorities that the different local health authorities have identified.
I believe Senator Titus has a question.
Yes, thank you, Madam Chair. And again, thank you for recognizing the importance of having some preemptive powers here and funds. You made a statement that brought a question to my mind. You commented that this funds would be allocated to the local health authorities or counties. So I need some clarification on that. Are you looking at allocating these funds to health districts? Because the health districts, as we know, Washoe, Clark, Carson, and now the new rural one. So that's several counties combined. And then would you then look at donating, I mean, not donating, but distributing those funds to the county board of health that do not have a health district? So that question came up. So it's not going to be 17 different counties. And then you said based on per capita. So you're looking at breaking down population. So this fund would be $4 per capita. So each a combined district, then all in that one district would get $4 per capita. So I need some clarification on that breakdown.
Joelle Gutman for the record, sorry for the confusion. So yes, you're right for the local health authorities. So the health districts would receive their population distribution. So some health districts represent multiple counties. So they would receive all of that. The counties that aren't represented by local health, by health districts, that money would go to DPBH so that DPBH could provide their public health services.
Julia Peak for the record, Nevada Division of Public and Behavioral Health. We do oversee a number of the counties, as you know, and provide the public health services. And so what we think that we will do in this case is we're going to work with the county boards of health to figure out what their gaps are in services. We also just completed the state health needs assessment that does look at county needs. So we're going to use a process, honestly, working with the county health officers to say what categorical funds are already addressing services, what are the gaps you've identified, and how do we work with that. The other thing is this funding could allow more counties to move forward with a health district, which ideally 10 years from now We have local health authorities in all the counties, and so public health services are delivered locally. The challenge in doing that now is that there aren't non-categorical infrastructure funds for these counties, and so the counties have to contribute a good amount of money to set up a local health district. This would really be the stepping stone to allow that foundation to occur. So that's my hope as well, is that these funds, if approved, would allow them to start moving through the process of regionalizing so that the state just has an oversight role, not really a hybrid role of providing direct services as well.
And thank you for that clarification. And again, just to follow up another comment that you made and clarification, the justification was that we have experienced this unpredicted health emergency, and no one questioned that was real. But these funds are not going to be set aside in case of another emergency. These funds, the purpose of these funds are to be implemented now in the gaps that we've already recognized doing these assessments, correct?
Julia Peak, for the record, I would say both. So ideally, we're going to say, let's say it's tobacco cessation, just for the sake of argument, that the county identifies that funds should be used toward a outreach campaign for tobacco cessation, and we're going to be moving forward with that path, should that be what the county or health district chooses to do. But then we get hit with COVID or whatever infectious disease issue occurs in the county, then we'd be able to reassess and redirect. Maybe we say we're not going to do the campaign, or we're going to stop a few months of the campaign to get more disease investigators on contract to address the specific issue at hand. Our current federal categorical grants, we have no latitude. And for example, the COVID grants we got from the federal partners were excellent in addressing COVID, but then when monkeypox hit our state, we couldn't redirect those funds, even though it was an infectious disease. Same type of staff, just a different interview, right? We couldn't redirect it. It was too categorical in that situation. And so we just want the ability to have more latitude in that regard. But we certainly wouldn't sit on the funds and say, just in case, it's a public health rainy day fund. That's not the intention. The intention is to be spent. But then should we have a specific crisis that we need to address in real time, then we say, okay, it's not going to go to tobacco cessation for the next 6 months. It's going to go to whatever that is.
Great, thank you. Because we needed that clarification, and especially with all this freestanding water that we have now, we may want to focus on West Nile with the mosquitoes. So thank you very much for your information. Thank you, Madam Chair.
Thank you very much. Is the Department of Taxation, I believe, is here, and if they could come down and give us some information, that would be very helpful. Thank you.
Thank you, Madam Chair. Jeff Mitchell, for the record, Deputy Director of Excise and Local Government Services within the Nevada Department of Taxation. We just received the amendment this morning and are reviewing it. To distribute monthly, there will be an impact, but unfortunately, I don't know what that impact will be off the top of my head. For information in FY 21-22, according to our annual report, the OTP, the other tobacco product tax, did generate roughly $35 million. And so 35% of that is $12.25 million. I will do my best to answer any other questions that you may have.
Any questions for the Department of Taxation? All right, thank you for that information. And I'm sorry that you just received this amendment this morning, but.
Jeff Mitchell, for the record. We will do our best to be responsive in submitting a fiscal
Please
note.
do so. Thank you. Thank you. All right, any other questions from the committee? Senator Neal, I see a quizzical look on your face. Nothing? You got nothing? Okay. All righty, well, then I think there are some more questions, but I think everybody needs to process the amendment and what is happening here. So we will move forward to those in support here in Carson City. Please go ahead when you're ready.
Good morning. My name is Kevin Dick, and I'm the District Health Officer for the Washoe County Health District, and I'm here in support of SB 118. Public health departments in Nevada are in vital need of additional funding and staffing. We need funding that is non-categorical. Money that can be used to address the health priorities of our communities, not funds that can only be used for a specific service or disease. Nationally, the de Beaumont Staffing Up study found that we need 80,000 additional, I'm sorry, for some reason I got nervous when I came up here. I faced a lot of press
Don't be nervous.
during
We're just regular
COVID-19,
folk
and this
on a
just feels
Saturday
a little
morning.
different right now. I'm sorry. The de Beaumont Staffing Up study found that we need 80,000 additional staff in public health departments. From our recent work with the National Public Health Foundation and using new staffing calculator tools, we found that our health district needs 33 additional staff just to provide foundational public health services, not including what we need for community-specific needs. The assessment showed we needed more epidemiology and disease investigation staff, so we could use the funds to retain some of the staff we will lose with the end of the federal COVID-19 and health equity grant funding. This would allow us to retain capacity for disease surveillance and assessment and to work with our disadvantaged and culturally diverse communities. The funds can be used to improve our data systems and use our data to better inform our decision-making and our communities. And it can help us to deliver programs in areas which we are currently falling short. Public health funding has historically cycled between panic and neglect. This investment can begin to provide the support public health requires in Nevada and move the state from 50th toward 45th in the nation for public health funding. For a strong economy and future for Nevada, we need to invest in the health and well-being of our population, not just in treating their illnesses. So I urge you to pass this bill. Thank you.
Thank you very much. Go ahead, please.
Good morning. My name is Nikki Aker. I'm the Director of Carson City Health and Human Services. And thank you for allowing me to say a few words about how this funding could assist my agency and the residents within our region. So my agency is highly grant or contract funded. So having non-categorical funding can assist when there is an interruption in funding, public health emergency, as we've spoke about, and our projects that are unique to our communities, which are identified by conducting a community health needs assessment. So we just completed our third needs assessment. We did this as a quad county assessment, so Carson City, Douglas, Lyon, and Story County, in collaboration with Carson Tahoe Health. And this needs assessment is looking at the needs of approximately 175,000 individuals. There's an estimated 1 in 10 households living below 100% federal poverty level in the Quad County region. And it's estimated that approximately 1 in 4 adults with employer health plans are considered uninsured and likely struggle to pay for out-of-pocket health care costs. And that's where your local health department can come in and help be that safety net for those individuals. Diabetes services rose to the top within our needs assessment, and at this point, we're unable to provide those services since we do not have grant funding for it and we can't use our other funding. The only chronic disease funding we currently receive is tobacco control and prevention, and my agency currently receives funding for vaping at this point, but that funding is in jeopardy. With this type of funding, it could be decided to use the funding to continue the programs that we are currently providing. And as we know, vaping is an epidemic among our youth. As Mr. Dick had indicated, we were able during COVID to expand our EPI division and have it as a standalone division, and that this type of funding could also help us retain that epidemiology staff.
Thank you very much. Senator Neal.
Thank you, Madam Chair. So can you clarify, why is your funding for vaping in jeopardy? Where does it come from?
So that comes from the state, and it's not a line item in the governor's budget. It's youth vaping prevention funds, so we need to come back and ask for that funding each legislative session. And right now, we're not sure that we're going to get it back.
But it does come from the OTP distribution, correct?
I would have to, thank you. It comes from the general fund.
Okay.
So I have a question following up on that. So if you have to come back to each 2 years or whatever to the governor to ask for this, why is it that the governor is he not okaying that? I'm confused about that piece.
Let's see, Joelle's been fighting really hard for this funding, and maybe, or Julia can help explain that.
Would you push your microphone,
I push
please?
it wrong. Oh, my apologies. Sorry, Julia Peak again for the record, Division of Public and Behavioral Health. We had the opportunity to work with former Senator Ratty, and she can speak to this as well, a few sessions ago to get some vaping tax money provided. It was provided, I believe, the last 2 sessions through an appropriation. It wasn't in the governor's recommended budget, and so we do have to come back every 2 years and ask for that funding again. So it is at jeopardy, as Ms. Aker had described.
Go ahead, please.
So former Senator Julia Ratty for the record, also with the Washoe County Health District now. And so if you go back to the 2019 session, we ran the bill to add 30% onto the OTP tax for vaping products. That funding was directed to the general fund. The public health advocates worked with me to get that funding in place, and we had hoped that it would be able to go to public health. But during that session, the priority was K-12 education. And so with many conversations with many of you, that funding was not directed in any way, shape, or form to public health. It was directed to the general fund, so it could be used for general government services, and the priority in that session was K-12 funding. In the subsequent session in 2021, it did not make it into the governor's budget, and so I had to work with the public health advocates and all of you again to get that allocation from general fund dollars. And once again in 2023, it was not put in the governor's budget. And again, the public health advocates are trying to get that allocation again. So it was included in the bill, the vaping tax bill, but the vaping tax all went to general fund, and then it was funded out of general fund. I hope that adds clarification.
So I have a quick question on that. Am I wrong, but wasn't there ARPA funding for this? Or wasn't there ARPA funding allocated with this?
Julia Peak, for the record, we did get a good amount of ARPA funding. I'm not sure if we got it specifically for youth vaping and cessation, but I can certainly look into it and get back to the committee. As you are well aware, the ARPA funding is time ending. Many of the projects were either set to conclude in 2024 or at best in 2027, I believe is the end date on those. So I can check into what level of ARPA funding, but that would be temporary as well.
Sure. This seems to be temporary if you're coming back every 2 years. So I thought maybe that's the reason the governor didn't include it, is because there was ARPA funding there. So with that, is there any additional questions or comments from the committee? All right, thank you all for being here today. All right, with that, is there any additional support here in Carson City? I'm sorry, go ahead, please, when you're ready.
Thank you. Good morning, Chair and members of the Senate Finance Committee. Happy Saturday Finance meeting to everyone here. Leah Case, L-E-A-C-A-S-E, here today on behalf of the Nevada Public Health Association. As you've heard from my colleagues and several members of the Nevada Public Health Association, SB 118 is a critical piece of funding Nevada's public health infrastructure. It does have that crucial sustained funding that we need to move forward with our public health infrastructure in the state. Currently, as Washoe County Health District mentioned, we are tied with Wisconsin to be 50th in the nation for public health funding at $72 per person per capita. This additional investment would bring us up to 45th in the nation, so we are moving up in the world with this investment, and the national average is $116. I would also add that the ability to allow non-adjacent counties to form these health districts is critical in our rural areas, just to kind of tie things together and allow them to work together towards sustainable public health infrastructure. Thank you so much.
Thank you very much. Go ahead, please.
Good morning, Madam Chair and members of the committee. For the record, Jennifer Berthiaume, that's B-E-R-T-H-I-A-U-M-E, Government Affairs Manager at the Nevada Association of Counties. On behalf of our members who represent all 17 of Nevada's counties, we are in support of SB 118 as it provides flexible funding to address local health needs and build vital public health infrastructure. Thank you.
Thank you very much. Any additional support here in Carson City? All right, seeing none in Las Vegas, please go ahead when you're ready.
Madam Chair, members of the committee, Isaac Tenorio with Strategy 360, today representing Churchill County. We urge you to support SB 118 because it'll increase access to health care in our state. Developing a sustainable public health stream will help Nevadans access the healthcare needs. This is an issue that's more pressing for rural Nevadans. Proper public health funding will provide a safeguard for our residents and will strengthen our society. Churchill County is in full support of SB 118. Madam Chair and members of the committee, we urge you your full support. Thank you so much.
Thank you very much. Go ahead, please.
Thank you, Chair. Bradley Mayer, partner with Argentum Partners, for the record, representing Southern Nevada Health District. So we've been working on some form of this issue for 3 sessions now to try to develop some sustainable funding, some sustainable non-categorical funding, as you've heard, for our health districts at the local level. We believe that Nevada may be one of the only states in the country that doesn't have actual direct funding for local public health. Mostly everything comes through the state and in terms of grants and other programs. And 2 quick examples that I would use of why, what we've done on the bill to have it be attached to the OTP as a sustainable funding source. 2 examples of programs that were about $1 million each that the health district had to stop. There was a program called Healthy Start, where in-home visits would be made with new mothers from low-income communities in order to help with some of the health disparities that you see. That was about a $900,000 grant that went away, and the program went away. Another one was a teen pregnancy prevention program that was also about $900,000 and went away a few years ago, and the program had to go away. Right now, Southern Nevada Health District is concerned about, the $84 million in COVID grants that are, of course, ending soon as the public health emergency was ended earlier this month. And as you heard before, in terms of coming back, as opposed to, say, looking at this from the money policy as a one-shot, that's how tobacco's been. And that's been about $2 million a year, so roughly $4 million a biennium that our partners throughout the state have participated in for tobacco, and that is something we've had to come back for. And then, of course, right now it is still not in the budget. And so being able to do it this way as Senator Ratty said earlier, OTP by its definition leads to riskier public health outcomes, if you will, right? I mean, it's vaping and tobacco use that is included in there. And so this makes sense in order to do that. And of course, because it's a percentage, as it rises, some of the revenue can rise with it. But as it falls, we take our fair share of the cut, as opposed to having our the program completely cut. from there. And this gives us the ability to, instead of sort of building up and tearing down programs around grant funding, to be able to look towards the needs of our different communities across the state and sort of, as I've kind of said it, be able to play offense in public health instead of just playing defense all the time. So we thanks for hearing this bill today and your consideration, and we would greatly urge your support and be quite grateful for this. Thank you.
Thank you very much. Any additional support in Las Vegas? All right, with that, we will go to the phone lines. BPS, when you're ready.
To testify in support of SB 118, press star 9 to take your place in the queue. Caller, you're unmuted.
Good morning, committee. This is Sheila Bray with the University of Nevada, Reno. We would like to express our support for Senate Bill 118. Our School of Public Health works throughout the state to provide public health education to each county and throughout our communities, and this will go far to help those communities stand up and be responsive to community needs. We are in full support. Thank you.
Next caller, please.
You're
Good morning.
unmuted.
This is Caleb Cage, representing the Central Nevada Health District, urging support of Senate Bill 118 for all of the reasons the previous commenters in support have provided. I also want to add on that Section 7 of this bill provides a key policy element that we would like to have considered and approved through a vote as well, which allows for counties that are not adjacent to form health districts. As you know, currently the Central Nevada Health District is comprised of Churchill County, Pershing County, Mineral County, the City of Fallon, and Eureka County. Eureka County is included through an interlocal agreement, while the other counties, because of their adjacency, are allowed to be full members. Removing the requirement for adjacency would allow us to include Eureka County as a full member and allow them to be members on the board and to receive all of the benefits of the health district, and would also allow other counties in the state to form health districts in a way that meets their geographic needs and their geographic interests. So we're very grateful for this bill coming forward. We appreciate your consideration and we urge your support. Thank you very much.
Good morning, Chair Dundaro-Luke and committee members. My name is Caitlin Gatchalian, C-A-I-T-L-I-N, last name G-A-T-C-H-A-L-I-A-N, and I'm the Government Relations Director for the American Heart Association, and we support this bill. Thank you.
Good morning, Madam Chair and members of the committee. This is Marlene Lockhart representing SEIU 1107. We are in strong support of SB 118 and feel that additional funds to the local health authorities will improve preparedness, response capabilities, and effectively address public health crises like COVID and protect the well-being of our communities. I went through my prepared testimony, and as each of the previous speakers addressed each item I had on it, that will conclude my support comments. Thank you very much.
Next caller, please.
Caller, press star 6 to unmute yourself, please. You're unmuted.
Good morning, Madam. Okay.
Good morning, Madam Chair and committee members. For the record, my name is Denise Ferguson. I am the CEO for Mount Grant General Hospital, and I am a board member for the Central Nevada Health District. I appreciate the opportunity to speak in support of SB 118, as this provides necessary funding for public health needs that will support critical health initiatives. This bill will also provide necessary infrastructure for communities in rural and frontier Nevada who have previously been unable to be represented. With the newly created Central Nevada Health District, many of our counties are identified as having some of the unhealthiest residents in Nevada. The need for public health education and resources is significant, and this funding and designation will reach those in dire need. Thank you for your time and consideration this morning.
Thank you very much. Next caller, please.
Chair Dondero Loop and members of the committee, good morning. My name is Megan Comlossy, that's Comlossy, and I am testifying on behalf of the Nevada Healthcare Workforce and Pipeline Development Work Group, which aims to improve, grow, and diversify Nevada's public health, behavioral health, and primary care workforces. Adequately funding the public health systems is essential for the health and safety of both residents and visitors, and it also contributes to the health of the state's economy. Healthy people have lower healthcare costs. They are more likely to show up for work, to be productive at work, and to engage in education and skills training. And Senate Bill 118 represents an investment in the health of all Nevadans and the systems that catch public health threats before they become crises, rather than waiting until they are public health emergencies, and they are far more costly. The work group recognizes the critical need for investment in public health infrastructure, of which workforce is a critical component, and appreciates your support of Senate Bill 118. Thank you.
Thank you very much. Next caller, please.
If you have just joined and would like to testify in support of SB 118, press star 9 to take your place in the queue.
Happy Saturday morning, Chair and members of the committee. This is Dora Martinez representing the Nevada Disability Peer Action Coalition, and I would like to say please support this bill and veto to prior callers, and thank you. Have a magnificent Saturday.
Thank you very much. Next caller, please.
Chair, the public line is open and working. However, there are no more callers wishing to testify in support at this time.
Thank you very much. Anyone in opposition here in Carson City? Las Vegas, any opposition? Phone lines, please. BPS when you're ready. Opposition for Senate Bill 118.
To testify in opposition of SB 118, press star 9 to take your place in the queue. There are no callers wishing to testify in opposition at this time.
Thank you very much. Neutral here in Carson City.
Julia Peak, Division of Public and Behavioral Health. Again, thank you for allowing me to talk again. I did get an answer on the ARPA, so I wanted to just get that on record for you. So we were awarded, with your permission, $500,000, and it's a complete pass-through for local health authorities. That's for general wellness, specifically focused on obesity and physical education, not focused on vaping. So no specific vaping ARPA funds at our agency. Thank you.
Thank you very much. Any additional neutral here in Carson City, in Las Vegas? And on the phone lines, BPS when you're ready.
Testify neutral to SB 118, press star 9 to take your place in the queue. There are no callers wishing to testify neutral at this time.
Thank you very much. Closing remarks, Senator? All righty. We'll close the hearing on Senate Bill 118, and we will open the hearing on Senate Bill 297. Please go ahead when you're ready.
Thank you, Chair Dondero Loop, Fabian Doñate for the record. I will make this one as quick as I can. Really quickly, Senate Bill 297 revises provisions relating for the establishment of the Nevada Memory Network. The policy is essentially, it's a partnership between UNLV School of Medicine and the University of Nevada, Reno to establish the Nevada Memory Network. They will help work together to provide primary care for dementia, diagnosing dementia, and helping folks that are patients in our state. The portion that deals with finance is Section 2. There is hereby an appropriation of $684,573, and this is the stand-up cost just to open up the partnership. That concludes the presentation of this bill.
Go ahead, please.
Benjamin Challenor, Director of Policy for the Alzheimer's Association. So that $684,000, as the Senator mentioned, it's a startup cost. It includes the being able to hire a director, which will start January 2024, and would also use to subsidize the social workers as well as the medical assistants, as everyone else would be able to bill and be able to get their funding through Medicare cost. If there are any questions.
Any questions from the committee? I have one. So the 684,000, it says it's to establish the Nevada Memory Network. So what are you establishing, if you will?
Are you asking, sorry, Ben Challoner for the record, are you asking what involves in the establishment? Okay, so it would involve creating the hubs, which each one will be one in North Nevada with the UNR Sanford Center, as well as one in Southern Nevada at UNLV. And they will be contracting out with the Lou Rural Center down in Southern Nevada, and up here with the Renown Institute for Neurology, or Renown Neurology Institute, my bad. They'll be, excuse me, contracting out, hiring the necessary director that will be housed at one of the hubs, and then contracting out some neurologists, neuropsychologists, the social workers as mentioned, medical assistants, and that will be along starting January 2024. And hopefully by the start of the fiscal year 2024-2025, it will be up and running by then.
Okay, thank you very much. All right, any other questions from the committee? Seeing none, we'll go to support in Carson City.
Thank you, Madam Chair, committee members. Ms. T. Grimmer representing the Alzheimer's Association. I know Ben already gave you the details. Somebody left their phone up here, by the way. Madam Chair, if you would indulge me very quickly, I would like to just put a couple numbers on the record to share with the committee why the cost of Alzheimer's is so high that I feel like we're at a point where we cannot ignore the cost of this to the state. In 2018, which I know is sort of old numbers, so you can imagine the magnitude of the numbers now, but the Alzheimer's Association did do a comprehensive study of the cost of Alzheimer's. And I'll just quickly go through some numbers. Nationally in that year, the cost of treating Alzheimer's was $2.7 billion. It's expected to increase by $20 billion year on year. Early diagnosis can save the $7.9 trillion over the age frame of Americans that are alive today with Alzheimer's. This also, 16 million Americans provide an estimated $18.4 billion of unpaid care in home care. So I just wanted to put some of those numbers on the record.
Thank you very much.
To sort of show the magnitude. Thank you, Madam Chair.
Thank you. Go ahead, please.
Good morning again. Leah Case for the record on behalf of the Nevada Public Health Association. My colleague, Ms. Grimmer, did a fantastic job of going over those numbers. I would only add that one of the issues we're facing, especially here in the north, are placements for folks who have Alzheimer's, who need higher levels of care, and this would help kind of problem solve and see what can be done there. So on behalf of the Nevada Public Health Association, we are in support.
Thank you very much. Any additional support here in Carson City? In Las Vegas, any support? On the phone lines, BPS when you're ready.
To testify in support of SB 297, press star 9 to take your place in the queue.
Good morning, Chair and members of the committee. For the record, my name is Amy Peterson, and I live in Boulder City, Nevada. You've heard the numbers, you've heard the comments. I'd like to share quickly my story. My fairy tale life came to a screeching halt when my husband, who was a commercial pilot, had to quit flying due to early symptoms of dementia. The initial signs were forgetfulness, poor judgment, inability to do familiar tasks. And the various doctors that we went to never mentioned dementia. Why would anybody suspect an active, healthy, 47-year-old man of having a disease that affected seniors? It took my pleading with the doctors for a referral to the neurologist before we got the answer, and it came back 47 years old, Alzheimer's disease, a disease that progressed rapidly and for which there was no cure, and there still is no cure. As unprepared as we were for the diagnosis, we had no idea what was to follow. I had to do my own research as to what to do. I read everything I could about Alzheimer's disease because once we received the diagnosis, the doctors told us to come back in 6 months. That was it. I was continually blindsided by the very real and dangerous situations that arose. There is not and was not a connected network of what do I do now in place that would help Nevadans through the Alzheimer journey. I had to learn how to navigate the health system, plan for our future, educate our friends and family about Drew's behaviors and his mental decline, and I resigned from my teaching position so that I could be the primary caregiver 24/7 to a man who was becoming completely dependent on me for everything. So my husband died just 2 weeks after his 58th birthday, and I now honor his memory by being a full-time volunteer for the Alzheimer's Association in Las Vegas, Desert Southwest chapter. I facilitate support groups, I present community educations, and I advocate for state and federal legislation. I volunteer in the attempt to help others find resources, consider their future planning, and to reassure them that they are not alone during this very unsettling journey. It's too late for my husband, but it's not too late for others. And an early diagnosis is pertinent to the livelihood of the person living with dementia and to their caregiver. It has shown to reduce costs, especially for the Medicaid program, and numerous studies show that an early diagnosis of dementia, along with caregiver interventions, such as training, can lead to reduced long-term care costs. This Senate Bill 297 includes an appropriation request of $684,000 to support the expansion of memory clinics, primary care training, and care navigators, essential components of an effective system of care. Funding would be appropriated to the UNLV and UNR schools of medicine and to community partners. I urge you to vote to pass Senate Bill 297, which will provide better access to an early and accurate dementia diagnosis and provide person-centered care planning to support the patient and the caregiver. Thank you for your time and your consideration.
Thank you, Ms. Peterson. We're sorry for your loss, but thank you for continuing your work. All right, with that, anybody else on the lines? BPS, please.
Good morning, Madam Chair and members of the committee. This is Sheila Bray with the University of Nevada, Reno. We would like to express our support for Senate Bill 297 and to thank the Senator and the committee for bringing forth this legislation. As you've heard, this bill will help us address a critical need that's facing our older adult population and those caregivers in both the care and further research that we can do in this area. We look forward to working with our partner UNLV on this, and we are in full support. Thank you.
Thank you very much. BPS, when you're ready for the next caller.
Thank you, Chair. There are no more callers wishing to testify at this time.
Thank you very much. With that, we will go to opposition. Anyone in Carson City in opposition? Las Vegas? On the phone lines, BPS, when you're ready.
To testify in opposition of SB 297, press star 9 and take your place in the queue. You're unmuted.
Good morning, Madam Chair, members of the committee. I'm actually calling in support of SB 297. This is Constance Brooks with UNLV. We are in support and looking forward to the partnership. Apologies for the mix-up.
Thank you very much. Any additional opposition for Senate Bill 297?
If you have just joined and would like to testify in opposition of SB 297, press star 9 to take your place in the queue. Press star 6 to unmute yourself, please.
Good morning. Could you all hear me?
We can hear you.
Thank you, Madam Chair and the committee members, and thank you to the sponsor. This is Dora Martinez representing the Nevada Disability Peer Action Coalition. We are in 100% support of this bill. Please pass it. Thank you. Have a great Saturday.
Are there any additional callers,
Chair,
BPS?
Thank you, Chair. The public line is open and working. However, there are no callers wishing to provide opposition at this time.
Thank you very much. I think you said there are no other callers. We'll go to neutral here in Carson City. Las Vegas, on the phone lines, BPS, neutral, please, when you're ready.
To testify neutral to SB 297, press star 9 to take your place in the queue. Chair, there are no callers wishing to testify neutral at this time.
Perfect. Great. Senator, any closing comments? Okay, I just have one quick question, Senator. I don't know who wants to answer this. Is this a one-time appropriation, or how will this be funded moving forward?
Sure. Thank you so much, Chair Fabian Iñate, for the record. So just to clarify, this was an interim bill that came from a committee. It was not sponsored by me or anyone. It's a collaboration between the institutions, and what they're looking for is a one-time appropriation to start up the Nevada Memory Network.
Okay, thank you very much. All right, with that being said, we'll close the hearing on Senate Bill 297, and we will open the hearing on Senate Bill 144. Senator Lang. Please go ahead when you're ready.
Good morning. I'm Roberta Lang for the record, and I represent Senate District 7 in Las Vegas. We're here today to talk to you about Senate Bill 144, which establishes a credit against certain taxes for a taxpayer who donates money to a career and technical program tax credit organization that makes grants to programs of career and technical education. And we'll go ahead and present a little bit about the bill and answer any questions you might have.
Good morning. My name is Amanda Morgan, Executive Director of Educate Nevada Now, powered by the Rogers Foundation. Very much appreciate the chair and committee members considering this important bill. I'll just have a few very brief remarks and I'll turn it over to Matt Morris. SB 144 is a bipartisan effort that would incentivize business and industry to invest in our traditional public and charter schools. The tax incentive on the modified business tax and insurance premium tax would directly and exclusively benefit career and technical education programs, or CTE. This would encourage businesses to directly support workforce development, economic diversification, and student access to these programs. Students that concentrate in CTE programs are more likely to graduate, earn more, and attend post-secondary education. They have been shown to also increase engagement and attendance for our most vulnerable student groups. This bill was modeled off similar programs throughout the country. Nevada currently has a tax incentive program for private schools, but none for public schools. This bill asks for $10 million per year allocation, and Matt will briefly discuss the bill.
Good morning, Madam Chair, members of the committee. Matt Morris, for the record, M-O-R-R-I-S with Holland and Hart, on behalf of Educate Nevada Now. Just really quickly want to thank Senator Lang for sponsoring this bill and the co-sponsors as well. I'm going to just go through very quickly the sections of SB 144 that have led to the fiscal note. Section 1, subsections 1 through 13, establish the CTE Program Tax Credit Organization, which will administer the CTE tax credits that are authorized under the bill. This section requires the Nevada Department of Taxation to select the CTE Program Tax Credit Organization, which must be a 501c3 tax-exempt entity that is incorporated in Nevada with experience administering the type of education-related grants that are authorized under the bill. Section 1, subsections 10 through 13 allow for the oversight of the CTE tax credit organization by the Nevada Department of Taxation and require the organization to maintain records and comply with any audit and permit the department to revoke the selection of any non-compliant organization that is selected to perform that role. This section also gives the department the discretion to perform audits as in existing statute in NRS Chapter 360. And then sections 3 through 10 authorize the Department of Taxation to approve tax credits against the modified business tax or the insurance premium tax for a taxpayer who donates to the CTE Program Tax Credit Organization. Each section works essentially the same way for the different in NRS 363A, 363B, and 680B, which govern the modified business tax for financial institutions, mining companies, and general businesses, and then the insurance premium taxes. So the department has submitted a fiscal note. Obviously, there's the up to $10 million per fiscal year for the CTE tax credit. And then there's a $348,000, component, which is for staff. The department is proposing to bring on 2 new staff members who would help to oversee this program. And then there are some one-time expenses for technical computer system and information services upgrades. So the total fiscal note with the tax credit component is $20,348,000 over the biennium. And I'm happy to answer any questions.
Thank you very much. So the tax credit is $20 million for the biennium. Is that correct?
Matt Morris, for the record, that's correct.
All right. And then we have a total of $200,000 estimate in fiscal year 24, $175,000 in fiscal year 25, and $348,000 or $349,000 in the future biennium to implement.
Matt Morris, for the record, that's correct.
Okay, thank you very much. All right, questions from the committee? All right, not seeing any right now. We'll let you go, and we'll go to support here in Carson City. Please go ahead when you're ready.
Thank you, Madam Chair. Leah Case, on behalf of Friends of Ace Charter High School this morning. ACE is a public high school in Reno, serving about 222 students right now in the building and trades, construction, HVAC, diesel mechanics, all of these trades that are really high-paying jobs and in desperate need of good funding. And as you know, when you're training students to do this kind of work, often you need to buy more than one 2x4 or get extra tools, or there's multiple things that come up when funding a building and trades high school. And on behalf of Friends of ACE, we appreciate this legislation. Thank you.
Thank you very much. And Chase is a public charter, am I correct? You said public school, so I was just checking.
My apologies. Leah Case for the record. ACE is a public charter high school.
Thank you. All right, thank you. Go ahead, please.
Thank you, Madam Chair. Alexis Modrex with the Nevada Chapter Associated General Contractors, here in support of the bill. Thank you.
Thank you very much. Any additional support here in Carson City? Las Vegas? On the phone lines, BPS, when you're ready.
To testify in support of SB 144, press star 9 and take your place in the queue.
Good morning, members of the committee. My name is Dr. Renee Cantu. I'm the Executive Director for Jobs for Nevada Graduates, and I am here to testify in support of SB 144. I'm sure that all of you know the research, but this would invest more money in PTE programs, which not only increases the graduation rate, it also has a huge return on investment for young people when they start earning money as adults going into careers. Studies from the Brown University Annenberg School show that there's a 30% starting earnings premium for young people who have a CTE degree. And as someone who works in the field, I can tell you when young people can see it, they can be it. So when a young person can see a career, they can become that. And that is where CTE is so important. It helps our young people to envision themselves in professional careers, and it also motivates them to want to remain in school because they now have a sense of purpose for what school accomplishes for them. Anyway, with that, I want to thank you for the opportunity to testify in support of SB 144, and thank you for the work on this important issue.
Thank you very much. Next caller, please.
Good morning, Chair, members of the committee. Amber Stidham with the Las Vegas Global Economic Alliance. I'll be brief to say that we support these measures and urge your support as well. Thank you.
Brief is good. Thank you very much. Next caller, please.
Good morning, members of the committee. Good morning. My name is Jaime Olivares. I live in Las Vegas, and I'm calling in support of SB 144 because our students, our workforce, and economy would benefit from this bill. Thank you.
Thank you very much. Next caller, please.
Good morning, Chair Dondero Loop and members of the committee. For the record, Mindy Elliott with Carrera, Nevada, representing the Economic Development Authority of Western Nevada. We would certainly like to thank Senator Lang for this important piece of legislation. I, too, will be brief. We support this legislation, and I have pom-poms that are being shaken. So we appreciate your support of the bill, and have a great Saturday.
Thank you so much. Next caller, please.
If you have just joined and would like to testify in support of SB 144, press star 9 to take your place in the queue.
My name is Rebecca Dirks Garcia from Las Vegas. I'm a mom of 3 Clark County students, and I'm the chair of the SOT at Veterans Tribute Career Technical Academy. And I am just calling in to support this because I know what a difference it makes in kids' lives to have access to these unique programs. As the immediate past president of Nevada PTA, I also appreciate the need to ensure that our businesses have an opportunity to invest in public education and support our kids. Thank you so much.
Thank you very much. Next caller, please.
Thank you, Chair. There are no more callers wishing to testify in support at this time.
Thank you very much. We'll go to opposition here in Carson City. Las Vegas, BPS on the phone lines, please.
Testify in opposition of SB 144, press star 9 to take your place in the queue.
Good morning, Chris Daly, Nevada State Education Association, the voice of Nevada educators for over 120 years in opposition to Senate Bill 144. While NSEA supports and is a proponent of career and technical education, we oppose the tax holiday scheme proposed in SB 144 on principle. Instead, we would recommend up to a $10 million annual appropriation for CTE from projected general fund revenues, which include the modified business tax. Similar to Opportunity Scholarship private school vouchers, the funding mechanism proposed in SB 144 acts really as an end run around the regular biennial budget process. While career and technical education is worthy of additional funding, the mechanism in SB 144 is the wrong way to do it. Granting businesses a dollar-for-dollar tax break gives corporations the veneer of giving without any actual charity involved. Instead, this tax break reduces state general fund revenues, creates more bureaucracy, limits the say of future elected officials in determining state priorities. Again, we believe the legislature should support career and technical education, but doing so by prioritizing these programs within the budget process. Thank you very much.
Thank you very much. Next caller, please.
Thank you, Chair. There are no more callers wishing to testify in opposition at this time.
Thank you very much. We'll go to neutral here in Carson City. In Las Vegas, on the phone lines, BPS when you're ready.
Testify neutral to SB 144, press star 9 to take your place in the queue. There are no callers wishing to testify neutral at this time.
Thank you very much. And with that, closing remarks, Senator Lang, thank you very much. We'll close the hearing on Senate Bill 144 and we'll open the hearing on Senate Bill 276. Senator Lang, please join us.
Thank you, Madam Chair. Again, my name is Roberta Lang, and I represent Senate District 7 in Clark County. I'm here today to talk to you about Senate Bill 276, which revises provisions related to collection agencies. And David, to my left, will go through the provisions of the bill and why we have a fiscal note.
Thank you very much. Please go ahead.
Madam Chair, members of the committee, my name is David Reed, and I am General Counsel to the Receivables Management Association International, also referred to as RMAI. RMAI is a nonprofit trade association which represents debt buyers and affiliated businesses. RMAI's membership requires participation in its industry-leading self-regulatory certification program. This program meets or exceeds most state and federal requirements and is considered the industry's gold standard. RMAI launched this self-regulatory program 10 years ago with strong encouragement from both the Consumer Financial Protection Bureau and the Federal Trade Commission. RMAI, as representatives of the debt buying industry, are asking for this regulation. Our members are good actors, and SB 276 will help to ensure that all companies operating in Nevada are held to a high standard. Currently, Nevada licenses collection agencies. Debt buying companies are companies that purchase debt, and the industry was created after the collection industry was originally regulated and required to be licensed. So this just simply brings debt buying companies within the definition of a collection agency and provides some additional modernization to the Act. I'd be happy to answer any questions that you might have, and I also would like to thank Senator Lang for the introduction of this bill.
Thank you very much. Any questions from the committee? All right. Seeing none, I'm just clear on the fiscal note, please. So the fiscal impact will be 280,000 in 24, 94,000 in 25, and 188 in the future biennium. Is that correct?
David Reed for the record. I believe FID is present who can speak to that, but the cost of the program is self-funding through the entities that are being regulated.
Thank you. All right, with that, seeing no questions or comments, we'll go to support for Senate Bill 276 here in Carson City. Senator Lang, I do have one quick question, if you don't mind, before I know that we're in the middle of support, but I just noticed we have an amendment. Is this something that you're considering? I apologize for the interruption.
It's quite all right, Madam Chair. Roberta Lang for the record. Are you talking about the conceptual amendment that was given?
It's from the HOA Collections, LLC.
David Reed for the record. I saw the memo that was put forth today. What it's asking for is clarification to a provision regarding the maintaining of records for 4 years by adding working from a remote location. Although it's in a section that is all about remote working. So I'm not sure if the provision is needed because the entire section of the bill involves remote work. So the language as it reads right now, the way it was intended to read, is that 4 years applies to remote work.
So, Mr. Reed, I'm sorry, just for clarification, did you know that this amendment was here or not?
I was not aware of it till this morning when it was on the table behind me.
All right, so it sounds like we need to work on this bill. Okay, thank you very much. And with that, I apologize. We'll go to support in Las Vegas. Seeing none, support on the phone lines. BPS when you're ready.
In support of SB 276, press star 9 to take your place in the queue. And there are no callers wishing to testify in support at this time.
Thank you very much. We'll go to opposition here in Carson City, in Las Vegas, and on the phone lines, BPS when you're ready.
Testify in opposition of SB 276, press star 9 to take your place in the queue. There are no callers wishing to testify in opposition at this time.
Thank you very much. We'll go to neutral here in Las Vegas. Excuse me, here in Carson City, in Las Vegas. Go ahead, please, when you're ready.
Good morning, Chair. This is Sandy O'Loughlin from the Financial Institutions Division. We're just here for any questions.
Thank you very much. Is anybody there in Las Vegas in opposition? All right, we'll go to the phone lines, please. BPS when you're ready.
Testify neutral to SB 276, press star 9 to take your place in the queue. There are no callers wishing to testify neutral at this time.
Thank you very much. We'll go to neutral here in Carson City, Las Vegas. On the phone lines.
I apologize, Chair.
Yes. Yes.
I thought you had earlier, I thought that was in neutral. I am in a neutral position from the FID.
All right. Yes, please go ahead, please.
Thank you.
Go ahead, please.
I'm just here to answer any questions. Sandy O'Loughlin for the record, just here for questions from the FID.
Okay, thank you very much. Any testimony in neutral then in Las Vegas? All right, BPS on the phone lines, please.
Testify neutral to SB 276, press star 9 to take your place in the queue. There are no callers wishing to testify neutral at this time.
Thank you very much. All right, with that, closing comments, Senator Lang. All right, with that, we'll close the hearing on Senate Bill 276, and we will open the hearing on Senate Bill 306, and Senator Spearman, we'll wait for you to get organized.
Thank you, Chair Dondero-Loop and members of the committee. My name is State Senator Pat Spearman. I represent Senate District 1 in Clark County, and we are here this morning to present to you Senate Bill 306, and I will just give the abbreviated version. We all know that in our society we have a number of people who have, shall we say, have economic challenges. And once upon a time when I was a very young child, we also, were on, quote, welfare. The one thing that I remember about that is there was no way to really get off because you couldn't have a bank account, you couldn't have a new car, and a number of things that you couldn't have. And also, having talked with several foster parents over the years and children who had aged out of foster care, some of the economic challenges that they had. And so Senate Bill 306 is really designed, working with the State Treasurer's Office, to develop individual development accounts for these two groups so that they have an opportunity to save, to get out of debt. They have an opportunity to save, to purchase a home, to start a small business. And then for those in foster care and for foster care parents, they have an opportunity to save so that when the foster care children age out of the system, they have some type of financial security. That is the genesis of the bill, and I will now turn it over to my co-presenter, Mr. Jimenez, with with the Nevada State Treasurer's Office.
Thank you, Senator and Madam Chair. Eric Jimenez with the State Treasurer's Office. For the record, Senate Bill 306 is a continuation of work that Senator Spearman and I have done since 2019. The committee may recall Senate Bill 188 from the last session, which established the framework for the individual development account program, along with the Council on Financial Independence. Simply put, Senate Bill 306 works to operationalize that and provide some funding. For the fiscal elements of the bill, you'll just see a provision in Section 2 for $3,840 for board member compensation and possible travel. And then in Section 3, you will see an appropriation of $1,920,000 in the upcoming fiscal year and $2,310,000 in the following fiscal year to be used to seed individual development accounts for children in the foster care system who are turning 18, so that they can have some money to start saving for those defined purposes as already outlined in statute. I will leave on one point. During the budget closings for the Treasurer's Office, you all approved a Deputy of Financial Security position that would serve as the administrator for the individual development account program and would service the Council on Financial Independence. So that is why you will see a zero fiscal note on Nellis. And that's it.
Okay. Any questions from the committee? I'll give you just a minute to process. So just to recap what you said, the state deputy treasurer of financial security will absorb this particular funding?
Eric Jimenez, for the record, that is correct, Madam Chair. I would note that there is one final piece of this puzzle that we've been working with LCB Fiscal on. There's a bill on Monday in Finance, Senate Bill 499, that would change just some statutory language to allow that deputy to exist, but we have the budget closing now. We would then have Senate Bill 499, and then we have the additional contemplated appropriation.
So there'll be a financial cost. It's just coming in another bill.
Correct. Eric Jimenez for the record, and that cost is going to be borne from the college savings endowment.
Mr. Thorley, please.
Sorry, I have donut in my mouth. Wayne Thorley for the record, LCB Fiscal. Yeah, in closing the budget for the State Treasurer's Office, the funding was included in the budget, contingent on this bill passing, which, as Mr. Mena said, will be heard on Monday.
Senator Gansard.
Thank you, Madam Chair. So in looking at this bill in Section 4, it looks like you can put up to $10,000 in a year, but then when you look at Section 3, it looks like there's a maximum of $15,000 per person, so I just want to make sure we've got those numbers right.
Yeah, thank you for the question, Senator. Eric Jimenez for the record. So this is contemplating two different things. In Section 1, or in Section 1, you'll see the increase in matching funds. So as initially contemplated, the individual development account program could service 3 defined populations and could be matched from the government or nonprofit or other sources. Those would be foster youth, people under the Medicaid system, and tenants of low-income housing. The idea is that they could save $1 and then be matched up to $10, I believe we have in statute. This bill is contemplating two things. One, it's increasing the potential matching amount, and then if you look in the language of Section 3, it's making a deposit for someone that opens one of those accounts. So what this is doing is potentially seeding each foster child who is turning 18 with $15,000, and then they would have that mechanism that would allow for them to participate in the matched savings program, so we can set them off on a path to being able to save going forward.
So they can actually, we'll seed them with $15,000 apiece, and then they can have another $10,000 in match for other dollars that come in. Is that per year?
Technically correct, Eric Jimenez for the record. They would have up to, but that second $10,000, they would be required to contribute a piece of that.
Okay, thank you.
And Madam Chair, with your permission, through you to Senator Sears-Gansert, the reason that we did that is because those who will be turning 18 between this fiscal year and the next fiscal year won't have enough time to really save up. And what we really know about children in foster care, if we don't give them some stability when they age out, 12:01 midnight on the day that they turn 18, they have no support. And so this is really designed to catch those who will not have enough time to get the savings that those behind them, those 16 and under, will get.
Thank you. I had one more question.
Please, go ahead.
Thank you. And so once they turn 18, do they just get this cash? Or do they have access to this 100%, or are there any limitations on how this can be spent?
Thank you for the question, Eric Jimenez for the record. There are limitations in several forms. Under NRS 422A, there are financial literacy requirements. So funding from the individual development account, assuming one was set up, would go to a nonprofit fiduciary organization, which would then be required to do financial literacy training to anyone that had an individual development account. So for these foster youth, one, they would be required to go through that financial literacy training. Two, under the similar section in statute, there are restrictions on what the dollars can be used for, and they are very similar to some of the other bills that we've talked about this session, but wealth generating, kind of income producing things like higher education, vocational education, buying a home, starting a small business, and then those funds are overseen by the fiduciary organization. So the individual would never get the cash without having a defined expense that's outlined in statute.
Thank you.
Thank you very much. Senator Titus.
Thank you. Thank you, Madam Chair, for the question. Exactly on the same lines as that. So that line of questioning on how they get access to the funds. You mentioned they have to have the expense, or they have to identify what the expense is, and then do these funds go directly to the individual or to, say, the school or whatever investment they're using these on?
Thank you, Senator Titus. Eric Jimenez for the record. We have not promulgated the regulations, so we want to ensure that funding goes they can apply, tell the fiduciary organization, I would like to spend $15,000 or $5,000 on educational expenses. I imagine we will put some sort of mechanic in those regulations that says it has to be transferred from the fiduciary organization just to ensure a little bit of oversight over those funds, but that's still a policy that would need to be decided by the Council on Financial Independence.
And follow up on that, if I might, Madam Chair. So the fiduciary is going to be the one that decides whether or not it's an appropriate use of the funds, depending on the regulations that you're yet to determine or set up.
Eric Jimenez, for the record, that's correct.
And Senator Titus, Senator Spearman, for the record, and the way we had envisioned it in 2019 to 21 is that when the fund is set up, they identify a goal. So it's not an ATM, but they identify a goal and they're saving towards that goal. And once they, for foster care children, once they reach 18, whatever that goal is, schooling, apprenticeship, apartment, whatever it is that they need to give them solid footing, then that money would be dispersed to them. And for those persons who are receiving social services, once they reach that goal, then that money would be dispersed to them for whatever the goal was, to purchase a home, the down payment, to start a small business, or to pay off debts that are keeping them from purchasing a home. So it's not an ATM. All of this will go through the fiduciary organization.
Thank you. And just along that same line then, so the individual could continue to put monies in that fund indefinitely?
Eric Jimenez, for the record, that is the intention of this program, and that's why the initial contribution is so important. We see this with ABLE accounts now. We had a program called the TOTS program where we seeded that with $12 billion, and what we've seen is a massive explosion in account growth for those kids, and people are continuing to save in those accounts. This account would be functionally just a little bit different in that they would be able to save without losing access to Medicaid or social services, but we're also requiring them, when they start saving, to start putting some skin in the game as well. So for every dollar they put in, we would have a level of match contribution as well.
Great. Thank you. Thank you, Madam Chair, for the questions.
Thank you very much. Any additional comments or questions? Okay, thank you very much. With that, we will go to support in Carson City, in Las Vegas. Please go ahead when you're ready. If you're talking, we cannot hear you. Did you push your microphone? Las Vegas, give me a thumbs up if you can hear me.
Sorry, I didn't know you were starting in Las Vegas, Chair. I apologize. This is Ashley Garza Kennedy representing Clark County here on behalf of our Department of Family Services. And we are in support of the bill, and we appreciate the state's efforts to help our foster children who are turning 18. And it is a great step forward to support the financial future of foster children. Thank you.
Thank you very much. Any additional support in Las Vegas? We'll go to the phone lines. BPS, when you're ready.
Thank you, Chair. To testify in support of SB 306, press star 9 to take your place in the queue.
Good morning, Madam Chair and beautiful, brilliant committee. This is Dora Martinez representing the Nevada Disability Peer Action Coalition. I have a granddaughter who is from the foster program, and I thank Eric Jimenez and Senator Spearman for this bill. Please support this bill, and thank you so much. Have a great Monday or Saturday. Thank you.
Thank you very much. All right, we will. Any additional callers in support, BPS?
Thank you, Chair. There are no more callers wishing to testify in support at this time.
Thank you very much. We'll go to opposition here in Carson City, in Las Vegas. On the phone lines, opposition. Please, BPS, when you're ready.
Testify in opposition of SB 306, press star 9 to take your place in the queue. Chair, there are no callers wishing to testify in opposition at this time.
Thank you very much. We'll go to neutral here in Carson City, Las Vegas, and on the phone lines, BPS, when you're ready.
testify neutral to SB 306, press star 9 to take your place in the queue. If there are no calls, you can testify neutral at this time.
Thank you very much. All right, with that, closing comments, Senator Spearman. We will close the hearing on Senate Bill 306, and we will go to Senate Bill 319. And please go ahead when you are ready, Senator Harris.
Good morning, Chair Dondera Loop, members of the Senate Finance Committee. My name is Dallas Harris. I represent District 11. Thank you all so much for taking the time to hear our bill today, Senate Bill 319. I'm joined with Mr. Rick McCann of the Nevada Association of Public Safety Officers. And so, as I'm sure you can guess, this bill is about collective bargaining, and it does one simple thing, and that is add Category 1, 2, and 3 peace officers under the definition of employee. The fiscal impact related to this bill is from the Department of Administration, Human Resource Management, largely associated with what they think will be the cost of additional workload due to the additional amount of employees that will be eligible to collectively bargain. With that, Chair, if you don't mind, I'll turn it over to Mr. McCann to speak a little bit, and then we'll subject ourselves to questions.
Thank you. Go ahead, Mr. McCann.
Good morning, Madam Chair, members of the committee and staff. Rick McCann, Nevada Association of Public Safety Officers, and a member of the Nevada Law Enforcement Coalition. As you know, as we just explained, SB 319 changes the definition of, quote, employee, end of quote, to be eligible for state collective bargaining to include unclassified Category 1, Category 2, and Category 3 peace officers. One thing to keep in mind is that, as a matter of practice, there's only one group of unclassified peace officers to which this bill should apply, and that is Category 2 gaming control officers. That's really what we're focused on here. To our knowledge, there are no unclassified Category 1 or Category 3 peace officers to whom this bill would apply. With respect to the fiscal note placed on SB 319 by the State Department of Human Resources Management, it says that the bill will increase the workload for HR, and therefore the state will require one Personnel Analyst 3, a PA3, position for the one Category 2 Gaming Control Group. These Personnel Analyst 3s all do the same things as far as we're able to see, because we've examined several different fiscal notes from DHRM, and they all do the same stuff. Currently, the State Labor Relations Unit, LRU, has 5 allocated full-time employees, plus an executive branch budget officer that assists in handling collective bargaining matters. Now, while the state's fiscal note on this SB 319 contemplates needing a new Personnel Analyst 3 for this new bargaining position of unclassified gaming control peace officers, the committee should be aware that those unclassified gaming control peace officers are already part of a union called the Nevada Peace Officers Association as one of its Category 2 officer units, and that entire group has negotiated now 2 contracts, one in 2019 or 20, and they just completed successfully another one. So they've actually completed 2 contracts with LRU. These people, the unclassified gaming control people, are already part of that unit. In other words, the folks who would become part of collective bargaining under SB 319 will automatically shift into an existing bargaining unit that is now being serviced by the state. By the way, NRS 288.515 outlines the current number of bargaining units that exist in Nevada for state employees. Currently, there are 11 of them. Unless the legislature increases the number of bargaining units, which SB 319 before you it does not seek to do, these unclassified gaming control Category 2 peace officers must be incorporated into the existing Category 2 bargaining unit. So again, there is no new bargaining unit that is coming out of this bill.
Mr. McCann, can I ask a question? I don't mean to interrupt you, but I just want some clarification. So I understand all the policy pieces, but this is just about gaming control officers, and this is just about them being in control in a collective bargaining unit. So can you give us the fiscal impact of this?
I'm about to.
Okay, perfect. Thank you.
Perfect timing, perfect timing. Long story short, the state is asking for another full-time position for an existing bargaining unit that will immediately be absorbed into an existing unit that has successfully bargained contracts, as I said, since about 2019. We do not begrudge the state for needing or wanting more employees to do the work. However, and here's the bottom line, we submit that this fiscal note is not necessary. For the record, by the way, during my conversations with the EMRB Commissioner Bruce Snyder a couple of days ago, he indicated he agrees with our analysis of this particular fiscal note, and he authorized me to say so. I do not know if Mr. Snyder is going to be able to join us here today, but he asked me to make that comment. So, long story short, Madam Chair, to answer your question, we don't think the fiscal note exists, or it exists, obviously, but we don't think it's necessary in this matter at all.
So you're telling me the fiscal impact of $80,500, $100,500 in fiscal 25, and $201 in the biennium for personnel and associated operating costs is not accurate?
I'm suggesting I'm saying the figures may be accurate. I'm suggesting to you that they do not need another personnel and analyst 3 around which this entire fiscal note is developed.
All right. Well, we might ask that question of an agency. Thank you very much. All right. Any additional comments? All right. With that, DHRM is in the room. Would you mind, Mr. Tuma? Somehow I always want to say to me, but Tuma. That's exactly why I have that problem. So thank you very much. But if you have luggage, that would be great. Not baggage, luggage. Okay, thank you very much. Please go ahead and would you talk about the fiscal note?
Absolutely. Matthew Tuma, Deputy Director for the Department of Administration, where DHRM exists. Wonderful to be with all of you on Saturday morning. So to give you a context of how we staff the Labor Relations Unit, we currently have 7 staffers for it. We have a deputy administrator, we have a deputy administrator, a supervisory personnel analyst, 4 personnel analyst 3s, and a personnel tech 3. So this fiscal note would be requesting the addition of 1 personnel analyst 3 position to support these activities. And so what kind of fueled this? Our staffing level for the Labor Relations Unit, it's important to understand that the ratio that we have supports the level and the number of employees who are currently in a collective bargaining unit that has exclusive representation and a collective bargaining agreement in place. That roughly represents about 20% of the state's executive workforce. It's not a staff that is sufficient to support all of the executive workforce and all of the employees that could potentially organize. This legislation would move roughly 160 employees, FTEs, out of a category where they are not allowed to receive representation right now because they're unclassified positions, and put them into one of the 11 existing bargaining units. And it would put these into units that already have exclusive representation and collective bargaining agreements that have been approved for the next biennium. So it would be taking employees who currently are not represented and putting them into a unit that has a collective bargaining agreement. There are 2 kind of managerial concerns that we would have that would fuel additional time and resources amongst the Labor Relations Unit. Number 1 is that these are supervisory employees. And so typically you'll see a separation between line staff and supervisory employees. So like in the existing statute for units, there is a separate unit for supervisory employees that groups everybody in together. There's also legislation pending before the legislature to move and separates out some of those supervisory units. But it's best practice, as indicated in our written fiscal note, that supervisory units be separated from line staff because there are different issues that affect supervisory positions than affect line staff positions. So putting these positions into units that, that they would be grouped with line staff creates some concerns from a managerial position that will have some issues come up that we'll have to deal with during the implementation and execution of the next biennium and the collective bargaining agreement that's already in place. The other caveat that we believe would drive some additional workload for our staff is you're taking unclassified employees who operate in a very different structure than 284 where classified employees operate. And so the existing collective bargaining agreement is crafted around the expectation that all of those employees are in the classified service, and we're adding another caveat where there could be a potential increase in grievances, there could be a potential increase in issues that will come up that our staff will have to deal with. And so that's what's fueling the identification of the need of an additional staffer to start in October 1 of the next biennium and continue on into the future. I can add some clarifications because this on how some of the other legislation that's under consideration would impact our fiscal note and issues, because there's several collective bargaining bills being considered where in particular, SB 166 would create new supervisory units for peace officers. And so in which case, if that legislation passes, it would modify our fiscal note because these employees would not go into the existing Category 1, 2, and 3 peace officer units. They would go into newly created units that don't have a collective bargaining unit in place right now.
So, Mr. Tooman, just to clarify, so there is a fiscal note on this particular bill, and the numbers that I read earlier, I can read them off to you, do stand a total of $200,000 for the biennium?
Yes, that is the Department of Administration's position, is that if this legislation passes and it's solely this legislation and affecting our collective bargaining statutes, then we would need that staffing level to support that. If this piece of legislation is passed in conjunction with SB 166, we also have a fiscal note attached to that bill for additional staff. We likely would not need it would likely not need to be combined. The two fiscal notes would not likely need to be combined. We would need the 2 additional staff identified under SB 166 for the implementation. We wouldn't need the additional one that we would be identifying in here. Does that make sense?
Sorta. All right. Questions from the committee? All right, thank you, Mr. Tuma, for joining us this morning. All right, anything you want to add before we go to support? All righty, support here in Carson City, please.
Kent Irvin, ERVIN, for the Nevada Faculty Alliance. We support state employees being able to bargain collectively with their employer, as do local government employees. Our bill, AB 224, on the other side, authorizes collective bargaining for unclassified employees in NSHE, but the definition of NSHE professional employees there does not overlap with Section 1 of SB 319. Regarding the fiscal impact, collective bargaining need not and has not added costs for state human resources since the passage of SB 135 in 2019. Please let me explain that. The DHRM, as you've heard, did create the new LRU, Labor Relations Unit, after the passage of SB 135. However, the number of budgeted commission positions at DHRM overall has gone down from 73 in FY 2019 to 65 in FY 2024. Also, a new per employee assessment to fund the LRU was added by SB 409 in 2021, but there has been actually a decrease in DHRM's personnel assessment in the budget for the next biennium that more than offsets the new LRU assessment. Evidently, the decreased need to support complex state employment processes under NRS 284 and other efficiencies have offset the required staff and costs for the LRU. Indeed, in justifying the elimination of 3 compliance investigator positions from their budget for the next biennium, the DHRM testified, and I'm quoting from the budget closing document, that the grievance and complaint processes outlined in Chapter 284 of NAC would be updated to align with the processes and collective bargaining agreements, which the division indicates are more efficient since they promote resolution of grievances and complaints at the lowest level possible within an agency prior to submitting a formal grievance or complaint, end quote. That implies that collective bargaining actually saves the state in labor relations effort, even with the additional staff of the LRU.
Thank you, Dr. Irvin. And I'll just remind everybody that's left in the room that this is a fiscal committee. And so please understand, while we're interested in the policy behind it, we can't address all those things because we're in a finance committee. Thank you very much. All right, with that being said, support here in Carson City. Any other support in Las Vegas? And on the phone lines, please, when you're ready.
Testify in support of SB 319. Press star 9 to take your place in the queue.
Madam Chair, members of the committee. Madam Chair, members of the committee, Carter Bundy with AFSCME. To address the fiscal note, we agree with the analysis by Mr. McCann. This really shouldn't require an additional person. While we respect DHRM noting that classified and unclassified do have slightly different issues, the issues aren't that dissimilar. And in the course of negotiating a contract, the idea that there would be required a full-time for a whole year person, we think is overstating it. And of course, we're very sympathetic to the fact that oftentimes state agencies are understaffed, but this bill itself shouldn't add any significant fiscal impact. So we thank the sponsor, we thank the advocates, and we hope that you will move this bill without a fiscal note. Thank you.
Thank you very much. Any additional callers in support? BPS.
Chair, there are no more callers wishing to testify in support at this time.
Thank you very much. Anyone in opposition here in Carson City, in Las Vegas? On the phone lines, BPS, when you're ready.
To testify in opposition of SB 319, press star 9 to take your place in the queue. Chair, there are no callers wishing to testify in opposition at this time.
Thank you very much. Neutral here in Carson City, Las Vegas. On the phone lines, BPS, when you're ready.
To testify neutral to SB 319, press star 9 to take your place in the queue. Chair, there are no callers wishing to testify neutral at this time.
Okay, thank you very much. Closing comments, Senator Harris.
Thank you, Madam Chair. I'm just going to make this very quick. Dallas Harris for the record. This fiscal note is duplicative. I think that's the best way to explain it. If we pass 166, there's no need to pass additional funding with this bill. Thank you.
Okay, thank you very much. And with that, I'll close the hearing on Senate Bill 319 and open the hearing on 327. Senator Orenshaw, thank you for your patience, and we welcome you to the table.
Good morning, Chair Don Darrell-Loop, members of the Senate Finance Committee. For the record, James Orenshaw, I represent State Senate District 21 down in Southern Nevada. To my left, I have Teresa Melendez, who I've worked very closely with on Senate Bill 327. She is an Indigenous advocate and organizer, and here to help me co-present Senate Bill 327. During the interim, I had many conversations with voting rights activists and with members of our tribes who talked to me about situations where under the current law, tribes had asked for polling places on tribal lands, but the clerk's registrars were not able to establish those polling places either during early voting, during election day. There's also an example of a tribe that had to go to court and had to sue to get a polling place. With your permission, Madam Chair, I'd like to turn it over to Teresa Melendez to kind of go over some of the rationale for the bill. But in short, the bill changes the default from opting in from a tribe having to request a polling place to the default being that the clerk's registrar shall establish a polling place unless the tribe says we don't want one on tribal land.
Thank you very much. Please go ahead when you're ready.
Good morning. For the record, my name is Teresa Melendez, and I'm an Indigenous organizer here in the state of Nevada. It's a pleasure to spend some time with you this morning and bless your guys' hearts for working so hard on Saturdays and everybody here. I really love Native advocacy work, so excited to be here with Senator Orenshaw this morning. And when the senator was asking for my title, the work that I'm doing is pro bono. And so I just call myself an Indigenous organizer. And ultimately the work that I do, I work with Indigenous folks with tribal nations here in the state of Nevada to help uplift Indigenous issues and solutions. And a lot of our tribal issues around power building are influenced by access to voting and access to democracy. And so this is a really important issue and near and dear to my heart, and I'm grateful to be here today. There are a total of 28 federally recognized tribes, bands, and colonies here in the state of Nevada. We have one of the largest Native populated states in the country. Of those 28 tribes, bands, and colonies, 25 of those communities have residential communities here in the state. 18 of those tribes, bands, and colonies have had early vote or election day polling locations, 13 election day polling locations, and 12 early vote polling locations. The tribes started advocating for reservation-based polling locations in a lawsuit against the Secretary of State in 2016, where they won that lawsuit, which established the first reservation-based polling locations. Since then, we've just been working with the county clerks and Secretary of State's office, Native or vote advocacy organizations to help improve the legislation to make access to voting more accessible for Indigenous people. This past election cycle, there were 11 tribes, bands, or colonies that requested a polling location. That's a great number. So I'm just going to share some information about who those tribes are and what they asked for and what they received. Just trying to reiterate the point why this legislation is needing just another step to improve voting access. Because in the past, the way the bill currently is written, or the law is currently written, is the tribes can request a polling location. And so these 11 tribes that I'm about to read off, they all requested, they completed the Secretary of State's form, they submitted to the county clerk's office requesting some form of early vote, an election day, or a ballot drop-off box. Some received all of what they asked for, some received some didn't receive anything. But they all requested it through the proper channels by the deadline. So the Shoshone-Paiute tribes, the Duck Valley Indian Reservation, they requested 2 weeks of early vote, election day, and a ballot drop-off box. After a lawsuit, they sued the Elko County Clerk's Office. They received 5 days of early vote and election day. Their population on that reservation is 1,200 people. They're about an hour and a half north of Elko. Their polling location historically has been in Elko. So folks in that community would drive 3 hours round trip to vote, which we know the number one factor that leads to voting. Turnout is ease of voting, and so a 3-hour round trip in the wintertime is a difficult drive. The Elko Band Colony right there in Elko, they requested 2 weeks of early vote and election day voting. They received 1 week of early vote, and their population is 700 people. The South Fork Band Council, which is under the Timuc tribe, they asked for election day in a ballot drop-off box, and they received nothing. I do not have population data for that community. Wells Band Council, under the Timuc tribe, they asked for election day in a ballot drop-off box. They received nothing. Their population is 177 people. Both of those communities are under Elko County Clerk's office. And then the Battle Mountain Band Council asked for 2 weeks of early vote and election day. They received nothing, and their population is 516 people. So the Shoshone-Paiute tribes of Duck Valley, the Elko Band, South Fork Band, Wells Band, and Battle Mountain Band are all in Elko County. And 3 of those 5 received none of the voting access they asked for. And then one of the tribes, Shoshone-Paiute tribes of Duck Valley, they sued for their 5 days of early vote and election day. To continue on, the Ely Shoshone tribe, they asked for election day and they got what they asked for. Yamba Shoshone tribe, they asked for election day. They received election day after being told by Nye County Clerk that they would not receive a polling location. With some support of some advocacy groups, they were able to secure election day polling location. Fallon Paiute Shoshone tribe asked for 2 days of early vote and election day. They got exactly what they asked for, and they have really developed a great relationship with their county clerk. Fort McDermott Paiute Shoshone tribe asked for 2 weeks of early vote and election day. They got everything they asked for. Yarrington Paiute tribe asked for 2 weeks of early vote and election day in a ballot drop-off box. They received election day and a drop-off box. Their population is 400 people. They were able to get the election day polling location with advocacy from outside groups, originally being told they would not get the even the election day polling location. And then Summit Lake Paiute tribe asked for 2 weeks of early vote and election day, and they received 2 weeks of early vote and election day. So that's just some of the data, just to reinforce the fact that as the law is written right now, it hasn't isn't being implemented as like the intent of the law. The way that the language is currently written, there's some ways to get around providing a polling location to a tribe, even though they follow the law. Yep.
I don't mean to cut you off, but is there any way we can I ask you some questions regarding the fiscal note?
Yeah, thank
I
you.
know that this was already thoroughly discussed in the policy committee. So the fiscal note as it stands, the amendment doesn't change any aspects of that fiscal note. Is that correct?
James Ornshall, Senate 21, through Chair Dondero Loop to Senator Wynn.
You can go directly to me.
Thank you, Senator Wynn. Correct. The amendment from Washoe County, that's a friendly amendment, and I don't believe it changes any of the fiscal notes. I don't want to speak for any of the clerks, registrars, or the Secretary of State, but I don't believe it would change any of the submitted fiscal notes.
And then I think that 1.1 fiscal note that's currently on the bill, does that take into consideration if every single tribal community requested this? And maybe this is something for the Secretary of State's office, they can answer it as well.
And Chair, if I could let Chief Deputy Secretary of State address that. No, I'm here to answer any questions. Thank you.
Thank you for the question, Senator Wynn. Gabriel DeCara, Chief Deputy Secretary of State for the record. So that 1.1 million figure is based on all of those potential tribal polling locations that do not currently already have a polling location set up. Once it's established for good. So I believe we noted that there are, I think, 39 total tribal voting centers, but of those 39, a portion are already set up. So I think this is for 21, 22. And again, in the bill, tribes can opt out, either opting out of the polling place or for early vote or election day or a ballot drop box or all of the above. And so that fiscal note represents the maximum potential fiscal impact. However, we expect it would be lower. I believe there are already some tribes who have expressed that they are not interested in having, for example, an in-person voting location during early vote, which would reduce the cost.
Perfect. Do we have any other questions from committee members? Go ahead, Senator Titus.
Thank you. I guess, Madam Vice Chair. I'm not sure. In any case, thanks for the question. I appreciate you being here and what you're trying to do. I think every vote is important. Every person who has a right to vote should be abled. One of the reasons that it's difficult for my rural counties to do that, to have all these drop-off boxes or polling places, is simply lack of staff. And they weren't even able to staff for the first time ever in my valley's history of Smith Valley this last election cycle. We could not go and early vote there. We did not have any of the voting. We had drop-off boxes only for a couple days, limited hours because of lack of staffing. So part of the issue that we have, again, is some alternative to that. And we had the discussion, and I don't see it being addressed, with one of the purposes of the all-mail ballots is so everybody has an option to vote. Mail services are available everywhere. But again, correct me if I'm wrong, one of the issues is that frequently on tribal lands, I also have a P.O. box, and those mail ballots can't be delivered to a P.O. box, correct?
Gabriel DeCara, for the record, I do not believe that is the case, or at the very least, the Secretary of State and I actually went up to Duck Valley and had conversations with the tribal secretary there and tribal council members, asked them specifically if there were issues with the delivery of mail ballots, and they indicated that there were not at that time.
Okay, so that's what I need a clarification on, because it's my understanding, and I think we talked, that they weren't able to get their mail, so that was an issue, but that's not an issue. They are getting their mail.
No.
Okay. Teresa Melendez for the record. And not all the reservations have regular mail delivery, so that is one of the issues. So in Duck Valley, it's not the U.S. Postal Service that comes out, and so they have mail delivery. I think it's 2 days a week, 2 or 3 days a week. And so that's one of the challenges, that it's not the normal mail system. We do have the P.O. boxes. Folks do receive their ballots. We also have a lot of issues with like homelessness or multifamily households. So there are issues with people not having permanent addresses to receive a ballot. And statistically, we know that Native people generally vote in person. And so that's why reservation-based polling locations work the best for our community, knowing a lot of folks don't have driver's licenses, don't have the way to get to Elko from Oahe, don't have a permanent address or a permanent home to get a ballot. So the polling locations where they can use their tribal ID to register to vote and vote work really well for our community. Thank you, Senator.
And just follow up on that, and thank you for that. One of the things that we had discussed, and perhaps for the future, would be a thought that we have already passed a bill in this building, at least through one house, regarding allowing folks who are homeless to use their address of wherever they are staying for their information, their business. And we had talked perhaps having those folks that don't have a permanent address use their tribal headquarters or some other address to receive that mail. So just keep that in thought for the future. And thank you, Madam Chair and Vice Chair, for the questions.
Thank you very much. And I just wanted to make it clear that what I heard. So mail ballots can be delivered to post office boxes. Okay, I just wanted to make sure that I had that clarification. They can. They can. C-A-N, not can. Senator Gokachia.
Thank you, Madam Chair, just for comment. I'm glad to hear they can be, because that's all I've got is a post office box, and most of the rurals are that way. One question I have for the Secretary of State. Duck Valley is divided by a state line. How do you deal with that?
Thank you for the question, Senator. It's an excellent one. So there are a number of difficulties.
Would you state your name for the record?
Gabriel DeCara, for the record. Thank you. Apologies. So all of the residents who live on the Nevada side of the state line are registered to vote in Nevada. There's a fun little quirk where there's actually a closer DMV in Idaho. So there are a number of tribal residents who have an Idaho driver's license with their Nevada address on it, which we've discussed with the Idaho Secretary of State, just so everyone's on the same page. But there is, so there's no issue regarding residency or their ability to vote in the state of Nevada.
Yeah, and I would just try to clarify that, the fact that the Idaho side, I assume, will be under Idaho law, and is there a difference? The response there, Ms. Melendez, can you respond to that?
Teresa Melendez for the record. I know that the tribe, after securing a polling location on the Nevada side, they're hoping to do the same thing by working with the Idaho Secretary of State for the Idaho side of the reservation. So, in this regards, Nevada's, you know, the shining light and the example. So that's great.
Thank you, Senator Gocochea. And actually, that reminds me, thank you, Ms. Melendez. Senator Titus, in response to your question around the inability to find staff here, there's a provision in this bill that would allow the Secretary of State's office to identify poll workers who are Nevada residents, but potentially from other counties, who are interested in staffing remote polling locations, not just at tribal polling locations, but rural polling locations overall. So if, for example, Lander County, Esmeralda County had a difficulty finding polling workers, the Secretary of State's office could identify volunteers from Clark County who are interested in work with the county clerks to get them the necessary training, and the Secretary of State would provide funding so that those poll workers could operate those locations.
And Teresa Melendez for the record. And to add to that, Senator Titus, another thing that's written in the, oh, thank you, sir, that's written in this bill is that when the county clerks meet with the tribal officials for their initial meeting, there are 3 or 4 questions that they have to determine, and one of them is to determine, is the tribe going to recruit poll workers for their community or not? And so that will also be taken care of in this bill.
All right. Additional comments, questions? All right. Thank you very much. Senator Orenchild, do you have anything you wanted to add?
Chair, I think Chief Deputy Secretary of State and Ms. Melendez handled it perfectly. Thank you for hearing Senate Bill 327. I hope you'll consider moving it forward.
Thank you very much. All right, with that, we'll go to support in Carson City. In Las Vegas, please go ahead when you're ready.
Good morning, everyone. My name is Carla Roman, and here with me today is Mrs. Yvonne Verjan. We are representing the Urban International Nations of Nevada, Intertribal Nations of Nevada, pardon me. And we're just here to express today that our Native American people have the right to vote and for our voices to be heard. So placing polls on Native land would afford that ability to, exercise that right. It would be great for voting polls to be made available to all Native American people on Native lands to facilitate voting. So we urge your full support to pass this bill, and we thank you very much for your consideration.
Thank you very much. Would you do me a favor, and would you please each say and spell your names for the record for our Secretary up here?
Absolutely. My name, Carla Roman, is spelled C-A-R-L-A-R-O-M-A-N.
Good morning. My name is Yvonne Hawk Verjan. Last name will be V as in Victor, E-R-J-A-N.
Okay, please go ahead if you have comments.
I surely also agree to support this bill to be passed. Thank you.
Thank you very much.
Thank you very much.
All right, anyone else in Las Vegas in support?
Good morning, Madam Chairwoman, members of the committee. My name is Jennifer Lanahan, Jennifer-Lanahan, and I'm here on behalf of the Las Vegas Paiute Tribe and the Reno Sparks Indian Colony. We want to thank Senator Orenthal for bringing this bill forward, and we strongly urge your support. Thank you.
Thank you very much. Anyone else there in Las Vegas? All right, we'll go to the phone lines. Please, BPS, when you're ready, in support.
Testify in support of SB 327. Press star 9 to take your place in the queue.
Good morning, Chair and the committee. This is Dora Martinez, representing the Nevada Disability Peer Action Coalition. We'd like to thank Senator Arnshaw and his co-presenter for this common sense bill. It's very inclusive and bring equitable to the Native Americans, and we urge you to please support it and pass it. Thank you. Have a great Saturday. I hope you get to go out and enjoy the sunshine.
Any additional callers, BPS?
Chair, caller, you're unmuted.
Good afternoon. My name is Carrie Dermick. I'm the Nevada State Director at All Voters Local Action. We are in strong support of SB 327, and we strongly urge you to pass this bill to clarify tribal nations' access to voting and to make it easier for every Nevadan to vote in future elections. Thank you so much.
Thank you very much. Any additional callers?
Yes, one moment, Chair. Caller, press *6 to unmute yourself, please.
Good morning, Chair and members of the committee. For the record, my name is Annette Magnus, and I'm the Executive Director of Battleborn Progress. We are here today in strong support of this bill. We thank Senator Orenshaw for his work. We think this is an important investment in our Indigenous communities, and we hope you all will support this bill. Thank you.
Chair, the public line is open and working. However, there are no more callers wishing to provide testimony at this time.
Thank you so much. And so we will go to opposition here in Carson City, in Las Vegas. On the phone lines, opposition, please.
To testify in opposition of SB 327, press *9 to take your place in the queue. Chair, there are no more callers wishing to testify in opposition at this time.
Thank you very much. And with that, we will go to neutral here in Carson City, Las Vegas. And on the phone lines, please.
By neutral to SB 327, press *9 to take your place in the queue.
Good morning, Chair and Committee. My name is Jamie Rodriguez. That's JamieRodriguez. I'm the Registrar of Voters for Washoe County. I was calling in today just to be able to answer any questions related to the amendment. And thanks Senator Orenshaw and the proponents for working with us to ensure that we are able to match this bill with the bill that was heard on Thursday. Happy to still answer any questions that the group may have or that the committee may have. One thing that I did want to note based on some of the questions from the committee, if I may very quickly, Chair, the question about ballot delivery to P.O. boxes. Yes, ballots can be delivered to post office boxes. However, because it's official mail and P.O. boxes are treated differently than like street address mail delivery, if the name of the individual is not on that post office box, then the ballot will be returned. So if it's a family and it's the husband and wife's name that's on the P.O. box, but not an adult child that they have or an additional family member who's using that P.O. box, those are likely to come back to us because it's not their official location to receive that type of mail. So that is one issue that we did run into pretty significantly in this last election. And one thing that we do know we need to educate more individuals on who do use P.O. boxes. We have a great number of communities in Washoe County, including not only the rules, but also Incline Village, that primarily do use P.O. boxes. So that is an issue that we are aware of that does kind of cause some issues with those who do use P.O. boxes. With that, like I said, happy to answer if there are any questions related to the amendment. Otherwise, thank you so much.
Thank you very much for that additional information. Any additional callers, BPS?
Chair, there are no more callers in support at this time.
Okay, thank you very much. Senator Orenshaw, do you have any closing remarks? Okay, then we will close the hearing on Senate Bill 327. That leaves us with one item, and that is public comment. Please remember that the calling number is 475-4499. The meeting ID is 833-6791-3706. Please press pound, and then when you are asked for the participant ID, please press pound again. So, public comment. BPS, anyone here in Carson City, Las Vegas? BPS, when you're ready.
If you would like to provide public comment, press star 9 to take your place in the queue. Chair, there are no callers wishing to provide public comment at this time.
Okay, with that, thank you very much. Thank you to all of you who joined us on Saturday morning and stayed through this exercise, and have a nice weekend, and we will see you Monday morning at 8 a.m. Thank you. This meeting is adjourned.